How does that look?
That looks good. I can see it.
Okay.
We want to not bounce if we can.
Okay.
All
I
right.
will try my best. Okay. So, my background, I have a PhD in clinical psychology, and my practice is in Newport Beach. And I see, kids pretty much from about 8 years old all the way through adults. My primary focus is in sports psychology, although we have a lot of clients that come in where we're helping them with, non-sport related issues like anxiety or depression or attention deficit disorder. And we really enjoy serving, the kids and teens of this area. And as a separate business, I also own an indoor baseball training academy, which with sports psychology, it's a blessing because I'm able to work out on a lot of the emotional tools within sport that sport can teach us, and in vivo in the training facilities. So it's a wonderful asset. And I, before we get started, I just wanted to mention that, today's meeting is presented as an educational presentation in nature and, should not be taken as therapeutic advice or as professional services rendered. But I've included some resources here in case the listeners, you or your family members have any concerns and would like to get some extra professional support. The American Psychological Association has wonderful articles on their website dealing with pandemic and a material that's really good for young kids all the way up through young adults and adults. So definitely check that out. The Orange County Psychological Association which I'm intimately involved with and served as past president, is a wonderful local resource to access psychologists with all kinds of specialties to fit your individual needs. And then, as I mentioned, my practice is in Newport Beach, and you can find us at orangecountysportspsychology.com. So just to begin, in my experience as a psychologist working through this time has been very interesting, and I've seen pretty broad reactions that cover the spectrum, from some people actually having less anxiety. And perhaps that's, related to this temporary relief of responsibilities or different pressures that we experience, to those who are very impacted and feeling quite disabled. So just wanted to note that, my warmest thoughts and wishes are with you and your families, as we are all quite impacted by this in big ways.
Thank you, Ben. And now we've got your slideshow up, so we can go back to your face now.
Oh, beautiful. Okay. Great. So, good. Okay. So I thought it would be helpful to see, some actual quotes coming from, these are youth through young adult clients, as many of these statements are probably quite relatable. And I also included the age ranges from the people who made the quotes. So, I'm worried about my grandmother. Everything seems optional. That's one of my favorites. And my sleep cycle is all messed up. And in order to keep getting better, I have to work. And right now I can't do anything about that. I'm terrible at this online learning process. I can't do it.
Let me guess, is that from a boy?
Yes, right. Yeah, well, no, it is interesting. The gender differences are interesting and how everybody's adapting, for sure. And, these last couple, having too much time and, when we've lost our structure, that can really add to the procrastination that happens. So we have less things to do and having trouble getting that done. So there's this sort of lack of motivation, general lack of motivation and or urgency to get things done. And then also just many athletes being forced into retirement. I have a couple of elite athletes at the Olympic level who, are really struggling with that, and it's challenging them before they are ready to really consider it. And from the high school seniors to the college seniors who've been cut short in their experiences, it's just creating a lot of grief. So, as we go through some of the material here, there's a lot of advisories out there, certainly that I've been exposed to, and in how to cope with COVID-19. And instead of recapping that information, I thought it might make more sense to talk about ways versus coping, how to thrive psychologically under these circumstances. And as a sports psychologist, I often explain the COVID-19 impact to athletes as being very, similar to having a serious injury, where being sidelined can affect, your relationships, how you're connecting with other people by, and also just feeling less important. From a competition standpoint, feeling unproductive because the work, that you're putting into your performance, and this goes for academics too, isn't always measurable at this point. So you lose that sense of importance, or just this general feeling of falling behind, or in other cases, job threat and actual job loss, which is, very imminent. So when there's a lot of uncertainty, which is certainly the case now, what our brain tries to do is protect us by focusing on the things that we don't want to happen, which eventually leads to focusing on the things that we don't have, or how limited we are. And that thought process obviously can branch off to many unhelpful directions. So whether we have a stress response, a stress reaction to a stressor, is dependent on two factors. And the first is our appraisal of the threat, the size of the threat. And that's the first piece. The second piece is our appraisal of the available coping tools that we have. And both of these factors are based on perception. So going to the next slide. So Ryan Holiday wrote an interesting book that explores obstacles and this concept of perception. And the tendency for, I think, a lot of people is to see obstacles in this way, how this sentence is written, that the obstacle is in the way, blocking us or preventing us, that you have to get over or get around the obstacle. However, if we look at this sentence and we remove one word from this sentence, it completely changes the meaning in a much more constructive direction or manner. So what word should be removed from this sentence? And then you can advance to the next slide. So the answer is the word in. Instead, the obstacle in the path becomes the path. Within every obstacle is an opportunity to improve our condition. There's no good or bad without us being involved. There's only perception. There is the event itself and the story we tell ourselves about what it means. So where our head goes, the body follows. Perception precedes action, and right action follows the right perspective. So I wanted to include this just because it's a helpful twist in how we think about things and how we can filter our experiences during this time. Next slide, please.
So great, Ben. This sounds like a great way for parents to really provide some guidance to kids, really reframing these issues. So you don't, this is wonderful. Really appreciate that.
Yeah, and I'll get into some additional ways that we can, personally reframe, but also help our kids to do that too. And, while some of these concepts are maybe a little bit more advanced or deeper, if you will, for lack of better description, I think we can apply it to all age ranges with our own touch.
Yeah, and I've also found that when I'm helping others, and particularly my son, or helping him do something like organize his thinking, organize his day, I take my own advice more often when I'm working with my son. So it can be helpful. I mean, I find that these things that you're talking about are just as applicable to me as an adult.
Yeah, and when we can practice it ourselves, we're learning it from one angle, and then when we have learned it well enough to go teach it, then we're actually learning it from a different angle when we go teach it. So I think it can reinforce it for us as adults and help with the modeling part that we need to be conscientious of it at this time. So if you there's more to this slide if you want to just open up the entire slide. So in my work with clients, we're focusing a lot at the moment on working with perception as it relates to these core psychological factors. So 3 key factors: confidence regardless of complications. Now, I don't know about the listeners, but I know that confidence definitely has been wavering over the last month or so for me and our family, and just with the uncertainty. And so it's hard to keep confidence when the uncertainty is in place. The second factor is concentration while surrounded by distractions, and then poise during extraordinary stress. So this sort of becomes a training methodology for all of us for addressing a few of the critical intangibles of performing better in our daily lives. And the way I look at it, is performance is performance is performance. And regardless of your line of work, whether you're in sales or you're staying at home with the kids, we're all performing in our own individual ways. And it's just interesting to look at how we can do it a little bit better. And every one of you as mindful parents, all the coaches out there, all the leaders out there, we all know how important these factors are here. But the reality of it is very few of us devote time and energy to their development. And these factors are too important to be left up to chance. There's a prime opportunity right now for us to practice these and work towards mastery and towards our overall effort of just having better balance and finding equilibrium in all of this. And what I would say, in simpler form, is just getting more comfortable with discomfort. Getting more comfortable with discomfort. And our kids need help with that too, don't they?
Sure.
Yep.
Okay.
It's been very difficult to adjust to a different environment of work. I had a lot more control in an office than I do at home, when there are more things vying for my attention, and I can't concentrate the way I had. And this is great. And think about trying to help. I have a 21-year-old who's home trying to do college work, and there's a lot of, but he can't structure his schedule the way he's used to it because his mom, take out the trash, come down to help this, do that, even it's not the same as it was when he was in school and he was a master of his own schedule. And I have a lot more experience in going with the flow than someone who's 21.
Yeah. I had one of my younger clients who said, I think I'm going to try to treat this as if I have to follow all the rules of the school. And so, I'm going to put my cell phone aside. I'm not going to have the TV on in the background. I'm not going to be going back and forth to the refrigerator constantly. So it was a way for her to kind of structure the adaptation for her, and just kind of falling back on that. You know, we're sort of raised to follow rules and have that structure.
I worked with someone on FaceTime with me to do joint calling, and he told me that his wife goes into her office at 5 a.m. and comes out at 6 p.m. And if he dared to go in one time, and he will never do it again.
Yeah, right.
So it's a whole new set of household rules. I mean, and that's got to be different for kids, not being able to talk to mommy and daddy, you know, because when we're home, typically we're available to them, you know, 100%. And now maybe we're in the middle of a Zoom call or giving a meteorological forecast or something. Yeah, and so that's going to be really different. Insights.
Yeah, and I think that, you know, it's sort of the patience that we know we need to give to our kids, we have to give to ourselves, and that some things are going to have to give, and that's probably okay for now. So just giving ourselves permission, you know, family first, obviously. But no, it's a real reality because everybody's working from home. Okay, so the next slide on confidence. So starting with these 3 psychological factors and you know, confidence, having confidence regardless of complications. I just think that this is, well, it's coming up a lot in my discussions, so that's why I decided to include it. But it is one of the hardest things to master because complications trigger something called perception, and perception starts to get in the way. And perception is how we look at things and is closely tied to our self-talk. And confidence is almost purely the result of self-talk. And now many people would argue that confidence has to do with past successes, which, you know, might be partially true, but it's mostly a byproduct of self-talk and how we're talking to ourselves. So now it's safe to say that we're experiencing major complications at the moment. And,
Yeah.
you know, how has this situation with...
Oh, I'm so sorry, but I didn't want to move on because I was hoping maybe you could unpack the self-talk a little bit.
Yeah, sure. So there, I like to think about self-talk from a sort of non-traditional standpoint, because we know we need to be more positive. We know that that's important, but the reality of it is that we're very much drawn towards the negative side of self-talk. It's human nature, and so we're so compelled and drawn towards it that it almost becomes, I know this is a strong word, but it almost becomes an addiction. And the issue is that there's paradoxical benefits to that. So, you know, when we make a mistake at work and we beat ourselves up, we know that's not good for our confidence, and we probably shouldn't do that, but we're still drawn towards it. When we watch the news and it's another hit that we're taking, you know, we're drawn to that. And so there's these benefits to thinking negatively. One example is for the students that I talk with them quite a bit about is, you know, when you have to sit down and do homework and then that self-talk kicks in, it's, here we go again, or it's going to be too tough, or it's going to take too long, or it's so boring. And we, you know, and we have those endless lectures around, and we need to be more positive, you know, and if you just sit down and do it, it would probably go pretty fast. But the reality of it is there's a benefit to them doing that. And for one, it aids procrastination, and procrastination is quick relief for the thing that you don't want to do. So there's a paradoxical benefit to the negative thinking. I would say in some cases that we can spin such a negative web around our experiences that it allows us to avoid taking responsibility for getting positive, becoming more positive. And because that in a lot of ways takes a lot more work. It's better in the long run and is longer lasting, but it takes mental energy. So hopefully that unpacks it a little bit more there for you, Melissa.
Yeah, thank you. It really does.
Yeah. And so, you know, the idea here then is our self-talk is pretty critical in me, and but our entire lives can be really looked at as an extended self-fulfilling prophecy, and that can go positive or that can go negative. And so anyway, in regards to our situation, the longer we sit out in quarantine, the more tempting it is to worry about falling behind. We make those predictions, questions start to creep in about the future and how far behind you'll be. I know a lot of, just struggling businesses and individuals, and it's hard to not go there. And, ultimately, will I be able to pick up where I left off before the whole world came to a halt? And so this is it's a interesting and challenging, but important training grounds for, I think, for all of us, if we can all get through this experience by learning unconditional confidence. So, because you see, conditional confidence is something anyone can have, because things are already going our way. And right now we need unconditional confidence. And if we can all choose to earn it now, how much of an advantage would that give you and your kids later, when we're through the woods? Next slide, please. So interestingly, confidence and concentration are not that separate or far off from each other. And confidence is important links to concentration, because when we are confident, it's easier to center or narrow our focus, right? When we have that self-doubt, we get really broad with our focus. We let a lot of irrelevant stuff come in. So it's easier to narrow our focus on what's relevant or important. So when you display that you are confident and you can handle the uncertainty that's going on now, not only will that be good modeling for your kids, but it will help you to focus on enjoying the time you have with them. Mm-hmm. So, with concentration, I treat it as a practicable skill, which, like every other skill, improves with quality practice. So I have a couple things I wanted to just throw your way so that you can get some repetitions on this. And on one end, I look at concentration can be trained by eliminating distractions. Now, this is not a novel idea, but for example, at dinner, everyone throws their cell phone in a basket on the table. If anyone grabs it before dinner is finished, they have to put $5 in the pot, and that can be used later for a family fun event. So it's a removal of distractions. We go through our day, it's so easy to just have those included, in a lot of it's electronics, right? On the other hand, we could intentionally introduce distractions as an opportunity to selectively attend to what's relevant. So, for example, try reading a book for 10 minutes a day, while in the background, turn on your favorite Netflix series loud enough so you can hear it, and try to stay focused on the book material. The next day, add music plus Netflix. And for that 10 minutes, you're putting on, what I call the human horse blinders to zone in, and test your ability to stay on track with unbroken and appropriate focus. Appropriate. And we talk about being present all the time. This is a way to train it. We're always multitasking, and while it does have its place, there's a lot of research that shows it's not great for the brain. But we definitely need repetitions on that single pointed focus. Okay, and then finally, the last psychological factor, poise. So what can we do to improve our poise under extraordinary stress? I think a really important starting point is reinterpreting stressors. Here's a favorite quote, a variation of a favorite quote. Worry is like a rocking chair. You can do it all day long and get nowhere. So in reinterpreting stressors, we can avoid making stress or a bad day worse than it actually is. How many of those bad days do we turn into worse days because we're not quite reframing properly? It happens a lot. So it's also helpful, excuse me, it's also helpful to separate stressors so one doesn't bleed into another. Each stressor can be its own. This way we can avoid a compound effect. And you know how that story goes. Yesterday was a rough day. You wake up in the morning, it starts off rough, and we say, here we go again. And we just need to be better separators. I give the analogy of the old whack-a-mole game where you have the big hammer and a mole pops up and you have to hammer it down. Well, each mole is the representation of a stressor. So every time it pops up, you got to knock it back down. So poise can also come from self-regulation. But here's the deal, you can't regulate what you're unaware of. And once you have awareness, then you have choice in how you respond. Otherwise, without awareness, we're just on autopilot and subject to whatever direction your self-talk is taking you that day. And our kids, the reality of it is our kids do well when we're doing well. And we have to carve out time to check in on our needs and, sort of one of those.
That's a great point.
Yeah. It's sort of one of those obvious things, but it's not always implemented.
I was going to ask you, Dr. Strack, if you could maybe speak to having good self-care, especially at this time.
Yeah. Well, it's for the parents. I think, we're not getting the emotional releases. We're not getting the physical releases that we're used to. Mm-hmm. And so I think, starting with those two variables and, if you're a single mom or a single dad and, you don't have a spouse to lean on, then, it can be a family member just to give you a little bit of a break. So it's self-advocating for what your needs are with family members or spouses, and really being in good communication. We're trying to do that a lot at home. We have young kids at home. So, my wife, she needs a break. And if I don't give her that break, it's not good. So, we're trying to really work on our communication at home and being in touch on a regular basis. And, does it have to be every day? It sort of depends on the circumstances, but, every couple of days we're checking in on how things are going. And then, we have our little ways of exercising. I can't go to the gym, which, sort of is a bummer, but there's lots of opportunities to get out. And we started some races in the front yard. So, we're doing some sprinting activity with the kids. Mm-hmm. And we're, creating some competition too, which is sort of fun. But, we know from the research how important exercise is for your mood. And the interesting thing, the amazing thing is only 10 minutes of exercise to get a mood boost. So I'm pretty sure we can probably all get that in on a daily basis.
You made a really great point that I wanted to emphasize. I know I struggled balancing work, and especially when my child was young. And I know from other mothers that I've spoken to and have known that the first one to go in the equation of care is the mom themselves. Like we always put ourselves last. Yeah. And I don't know if it's a generational thing, but it's really a bad practice because, as you said, the kids do well when the parents do well. And if we can kind of retrain our thinking that we have to be doing well in order to take care of our children, so that,
Yeah.
so, we have needs that must be met. I mean, it's really a great point.
Yeah, and for all the super moms out there, they're doing it, and they're doing it really well. But I think you're right, and part of the issue that comes up is that even for young kids, we can enable a lot of dependency. So we have to be careful with how we're running the super mom program. And this is a wonderful time to get some help. Even for the 3 and 4-year-olds, they get it, and they can help clean up, and that can be a part of the daily structure. At 12 o'clock, we do cleanup before we eat lunch, or whatever it might be, and that can even be built in with some reward systems and that sort of thing. But it teaches them that there's this reality of that everybody can do their part, and that can be rewarded, and then it takes a little bit of pressure off of you.
You can also see responsibility is something that children can take pride in and comfort, that they have some ability to control their environment.
Yeah, absolutely. That sense of the sense of influence that they're able to influence is really, really good for their emotional state and their confidence levels as well.
Great.
So just some additional things to consider, I guess, if you will. The ongoing question for the athletes that I work with is, how hard should we train? And that's a real issue that they need to go back with their trainers on and talk with them. But I'm recommending keep training like the next thing is going to happen as planned. And I think that's a better perspective than just staying stuck in limbo. And then if the next thing doesn't happen, we'll adjust. And so that seems to be a better perspective on it.
Flexibility, in other words.
Yeah. And, it goes without saying that everybody's experiencing the lack of resources, but at the same time, let's make sure we're not making the lack of resources an excuse to lack creativity. Because at this moment, we are really only limited by our creativity. So one of the top issues that I'm bumping into is sleep.
Yeah.
So, stress levels. So going back to self-care wears on quality of sleep, and then obviously lack of sleep, starts to play on your immune system and, starts to affect T-cell functioning and immune defense. So, let's also take this time to work on sleep hygiene. Now with the teens, a lot of parents are concerned with their kids sleeping in too much. And, so we could talk a little bit about the difference between, like, when is that a concern versus, it's okay to let them go a little bit. But it's also important to be, updated in terms of the news on what's going on, but pick a level of consumption that's a good fit for you. One of the things that we started doing is checking every other day. We started that about a week ago, and it's an okay frequency. I'm thinking I can probably go every third day. And just be aware also that how you talk about the news affects your kids. Mm-hmm. So just monitor that. Mm-hmm. Love competing. As a sports psychologist, I talk about it all the time, but you don't need to be in an athletic setting to have fun doing it. Set out for a weekly mental challenge with a board game. Have your kids teach you their favorite video games. Join in. Yeah. There's no reason you can't do that. We're fighting it. The old saying, if you can't beat them, join them, right?
I'm learning CSGO, and I downloaded Overwatch. I don't usually play first-person shooter, but I have been enjoying it.
Yeah. Well, there's parents may not like to hear this, but there is a lot of research coming, not a lot, but there is some research coming out that there's some cognitive benefits to the game playing. So, of course, in moderation. But also, you know, one of the things we've been doing is YouTubing a lot of stuff, whatever that might be, just, you know, yoga, jump roping skills.
Oh.
There's some really cool tricks out there, and the kids love it too. And you can do that in the front yard, the backyard, even in the house. So just work on the competition piece. The next bullet point is one of my favorites: finding the thing that you're avoiding most and take action by turning towards it. Because the biggest needle movers that can push progress forward tend to be the things you're avoiding the most. So that could be on a physical level, it could be on an emotional level. And then finally, use humor, and lots of it. I hope you're all doing that. In my home, we've been practicing knock-knock jokes and other types. With my kids being 4 and 6 years old, the latest one, with today actually being Earth Day, which tickled them quite a bit, was, why did Mickey Mouse fly into outer space? To find Pluto.
That's great.
So my wife actually laughed at that one too. So there you go. Simple fun. So anyway, that, I think we can move into some questions, but, you know, I just wanted to wrap up by saying, you know, I hope you're able to take a few of these bullet points from this presentation. You know, I encourage you to carry it forward for yourself and find a way to teach it with your own touch, with your kids, and wish you and your family's wellness and health. And, you know, we're all going to get through this together. And thank you very much for your time.
Thank you.
Well, I had a couple questions, if it's okay.
Sure.
I really liked your advice that said plan as if the next season, the next event is going to happen. Can you talk to us a little bit about that? Because I know that, just speaking for myself, my family, my not young son, but, you know, he's 21. It's very hard to picture life going back to normal sometimes.
Yeah.
You know, when we walk outside and we have this sense of contagion and the sense that the whole world is turned upside down. I'd love to talk about your advice, like why you give that advice, what that does to help us, and how we can really practice that.
Yeah, well, I think it really breaks down to the whole idea of goals. And, you know, there's short term and there's long term, and this is touching more on the longer term goals. There's things that we can do today, but if we don't have that foresight into the future of the thing that we want to accomplish or get to, you know, that's hope. And while hope is not the assurance that something is true, we still need it. And it's, you know, those longer term goals and even the big goals, like the ones that we should be dreaming about. It's important to have those goals that we dream about as well. It's a big part of our motivation and what kind of keeps us moving forward, that sense of things to look forward to. And the reality of it is, if we're listening to our rational thoughts, you know, the next thing is going to happen eventually.
Great. Now, what are you seeing? I mean, you typically do a sports practice, but we're not doing a lot of sports now. So how are you talking one of the things I've seen is that talking to kids about disappointment. How can we help our children who have been deeply disappointed at missing maybe a prom, and maybe they'll never get that back, or missing graduation walk, or some really major events? How can we help our kids deal with that kind of deep and unusual disappointment?
Yeah, it's really tough. There's a lot of pain behind, you know, those things disappearing, those opportunities disappearing. And I'll tell you what we shouldn't do first. And I think that's automatically just look to the future and tell them, you know, what they should be focusing on, because what that does is, and there might be a time and place for it, but it doesn't validate where they're at right now. And I think that's the first thing we need to do, is sit with their pain and just, you know, kind of sit with the suck part of it, which is theirs and it's real. And however they're feeling is probably fine. You know, I've a lot of student athletes who are, you know, just feeling unmotivated, and we're talking about, you know what, it's okay that you're feeling unmotivated. If this is an issue, you know, in a couple of weeks, then we need to take a little stronger look at it. But just validating right and staying with where they're at, because the mindset for most of us as parents is we want our kids to feel better. We want them to feel good. And so we're looking at, you know, either on one end, how to fix it, which is not validating their emotions, not being present, or the things that we can do to kind of get over it. So I think just really sitting with them, and you know, connecting with where they're at emotionally is a really good starting point. And then encouragement can come on the back end of that, but validate first.
Very important. I mean, I know as a parent, I immediately want to go into fixing it, you know, and cheering them up and saying, this is going to be better soon. But of course, you make a great point about validating their feelings. What about if, I mean, we're talking about kind of a baseline of most kids, but what if in this very, very difficult time, parents feel that their kids might need some outside help? Where would we do that? I mean, I know, for example, my son needed, he was home from college and he needed a prescription. And so it was easy for us to call Kaiser, and they had a telemedicine. But what if it's for mental health? How can we access mental health in a time of social distancing for our kids?
Yeah. Excuse me. So we're also, most psychologists have moved their practices to telehealth, telepsychology. So Zoom is one of the platforms that we're using today, which many of us are using for their HIPAA compliant. So you know, it's setting up in a quiet space, which is not always easy, but you know, this is a time that we need to be flexible, and if kids need help and they need some extra support, you know, we can make it work, and through that flexibility. So, and in a lot of ways, the Zoom sessions or the virtual meetings can benefit certain types of issues that are going on. So, for example, this is, you know, with viruses, it's a huge trigger for someone who has OCD. But we can practice. That's not an area that I specifically treat, but a lot of my colleagues will have the benefit of helping them with interventions in their own home setting where you wouldn't have access to that otherwise. So it's a great opportunity to work on things that you wouldn't in the office setting. So, and most of, you know, all the clients that I'm working with have responded really well to meeting virtually, and they're sort of used to it already. And we talk about it. If there's any glitches or discomforts, we work through it. So it's really sort of, I've been doing it for years, but I know a lot of my colleagues are just kind of picking up for the first time, and it's really working out well.
Great. Well, that's good. We don't want people to think that they don't have access when we can be doing it on the phone. Another question that I thought that was sent to me was, how should we be talking to our children about COVID-19? It's kind of scary. Yeah.
Yeah, and you know, and it's tough to miss, right? So all you have to do is kind of take a jaunt down to the grocery store, and everybody's wearing masks, and that might be a little spooky for a 3, 4, 5, 6-year-old or even older. So I think especially for the young ones, there's I referred to American Psychological Association, and they have some wonderful resources and books, free books that is a story on how to kind of talk with your younger kids about the virus and things that we can do to, take some of the control back and protect ourselves and be safe. But it's okay to have an honest conversation that this is happening, that people are getting ill from it, but that most people are getting better too, and people are moving in the right direction. So for the little ones, it's a careful balance, because obviously we don't want to inundate them with unnecessary or too much information. But they are aware, they are sensitive, so it's okay to have that conversation. And I can, Melissa, I can give you the reference for that online book for any listeners who might be interested in getting access to that.
Wonderful. Wonderful. That sounds great.
Yeah. Yeah.
Okay. So is there anything you'd like to leave us with? Maybe some general tips for everyone? I mean, I found that your advice and your perspective was useful, not just for teens and kids, but for whole families. So is there anything you want to hit in particular?
Yeah, no, I mean, I think during this time of uncertainty kind of brings out and magnifies this anxiety in all of us. And as much as we need to validate that in our kids and their experiences and the things how it's affecting them, it's normal right now. And so everything that you're feeling, the frustration, the irritability, the anxiety, whatever it is, it's all probably okay right now. And we need to keep it in check and work on it, but just to be patient with yourselves as well.
Great. Well, thank you, Dr. Strack. I really appreciate you taking the time to talk with us today. We've been recording the program. We're going to be putting it up, and you're available for consultation directly. I love the focus on sports and competition while we're all at home, and kind of the new solutions that you put out there for us. I really appreciate you taking the time. So we're gonna end our recording here, and I just want to give you a big thank you for helping us out today.
Thank you for having me.
Thank you, Doctor.
Okay.
Take care. Be well.
Stay safe. Bye-bye.
Bye-bye.
Bye.